This is ASAP Pathway. Hi, everybody. Welcome back, friends. Another episode, another time for us to sit together and share and learn and hopefully have a good time and throw some laughs in there while we're at it. Really excited today. I have my partner, Tracey, Dr. Tracey, with me today, and we are honored to bring back kind of a part two with Dr. Maggie Graham. Hey, Meggie.
Hi.
We did a podcast episode, episode 19, with you and your partner, Liz Turner, Dr. Liz Turner. And for those of you who would like to kind of catch up, because we're going to do kind of a continuation and some newer information today, go back to episode 19. Listen to their introduction. They're super impressive. We need more. We need more Maggie Grahams in the world. I actually was telling that to Tracey before we got on with you. Just you're an amazing person. I would love to do an introduction of what you guys, you and Dr. Turner are doing. That's a little different from the last time we talked. To get this conversation going, is that okay with you?
Of course. What was the date of episode 19?
It was back in, oh shoot, you would ask me that. I have it written
Sorry.
down, but if you just go, it's episode 19.
Okay. I'm
Um,
just curious. Time is such a blur to me right now, and I'm so curious as to like what has happened in what kind of time frame. I'll look it up and I'll report
you know
back.
what? It's funny. I'll look it up here in a second because I actually asked what the date was. I wanted to know when that was because it was kind of hard to believe that it was that long ago, and it
Exactly.
was. It
Yeah.
was a while ago. So let me dive in and just talk about your joint bio. Even though Dr. Turner isn't here, Liz isn't here today, but both Dr. Maggie Graham and Liz Turner co-founded Untethered Airway Health Center, where they help people of all ages thrive through airway-focused dentistry. They are leading experts in breathing-related sleep disorders, tethered oral tissues, and comprehensive dentistry. They recently launched their podcast, No One Told Me, the Airway Health Connection. They're passionate about mentorship and education. They created the Untethered Way, a comprehensive course designed to help dental colleagues understand the critical intersection of dentistry and airway health. Through this program, they provide practical guidance on integrating airway-focused principles into everyday practice, empowering clinicians to optimize patient outcomes and rethink traditional approaches to oral health. Excited to talk about this. This is
Thank
good
you.
stuff. Good stuff. Um, Last time we talked about, and for people that don't understand, I kept saying the word untethered, untethered. You have a passion to do, to approach tethered, which is would be maybe referred to as tongue ties. Um, you have a passion to do it in a way that what you view as kind of the right way to do things. More of a global approach is what you were saying before we started. And you're passionate about making sure that patients are being cared for properly, that healthcare providers are being educated so that we can work collaboratively with our medical colleagues, but also that you are wanting more dentists educated in this way so that this can be done and not just like come to your practice specifically in your town, but that this can be expanded on and become kind of a movement, if you will.
Correct. Absolutely. It's interesting. The evolution of Untethered is it started, the name of the practice started as Untethered Tongue Tie Center. And then from there, it became Untethered Airway Health and Tongue Tie Center. And finally, I just dropped the tongue tie part of it because, you know, tongue ties are a big part of many patients' journeys. It's a puzzle piece for a lot of people. But I think it gives the idea that there is a magic bullet to making people function better and have better structure in general, but it's too isolated. It's too narrow focused when it's connected to a whole body. So we finally just dropped it and said, you know what is our mission? Our mission is to help patients breathe better, to feel better, to be systemically and dentally healthier. So we just kept it to in general airway health. And so when Untethered started, Untethered was very, you know, catchy with its reference to tethered oral tissues, but now I look at it as more poetic, and it's untethered from traditional medical care, and kind of giving a different trajectory option for patients rather than putting up.
I love Untethered. It,
Thank
like
you.
you said, it's very poetic. It's very, it encompasses a lot of things beyond releasing tongue ties. For people listening that maybe haven't listened to episode 19, they don't understand what's the big deal. Why are you so passionate about tongue ties? What can happen if someone has a tongue? What is a tongue tie? And what can happen if somebody's tongue is tied and they don't compensate well?
Yeah, that's a great question. And until I went down this journey, I didn't know. We were taught in school that basically anything that we didn't quite understand was called a variation of normal. And that's what we were told tongue ties were. And if the frenum under the tongue limited the tongue's mobility, but the patient was still able to speak, that was kind of the end of what we learned. And now we know that while having a string or a piece of fascia or a frenum under the tongue is normal anatomy, if it's too short or it's restricting ideal movement of the facial muscles, especially the tongue muscle or any facial muscles, it's pathologic. It's causing compensations, and it's causing compensations as early as 12 weeks in utero when we start to swallow. And so humans are absolutely amazing and adaptive, and we will figure out how to get things done through adaptation and compensation. So when it comes to restrictions in oral tissues, if the tongue can't function ideally, and what I mean by that, the tongue should rest in its entirety on the roof of the mouth. When we swallow, we should have muscle silence on the external part of our face, and just the tongue should move. And if that's happening, starting in infancy and early childhood, it's growing our facial structure wide and forward. And if it doesn't happen, it's going to start us on an altered growth trajectory. And with that growth trajectory comes risk for other things that we're going to have to adapt to. So we might have more dental disease, we might have breathing issues. And so that's a really generalized overview of how a tongue tie can influence how our structure changes from the get-go.
I
Um,
um I love that when you were talking about facial silence because, when I went down this rabbit hole, I remember I learned a couple little exercises where you would like, get the lips, kind of put your fingers in and get the lips out of the way and then see if someone can swallow without using their face and just to see if they have facial silence when they swallowed. And man, some people, when they're trying to swallow that have improper swallows, I mean, they're really using their face. It's like it almost kind of caves in every single time they're trying to swallow. And that has an effect on growth and development.
Totally. We know that form follows function or follows dysfunction. And one of the things I'll do without even creating awareness, because I don't want to make a patient subconsciously overthink it, is during an exam, I'm looking at different things. I'm looking at everything, right? Oral cancer screening, looking at the teeth, looking at the gum tissue. I'll take my fingers out of the mouth and say, I'm sorry, let me give you a break. Go ahead and swallow. And then I watch them because without their awareness that I'm observing them, they're going to swallow naturally. And it's fascinating because you can watch, and I know this is a podcast, so most of you can't see what I'm doing, but you'll watch the orbicularis oris or the circular muscle around the mouth pucker and tighten. You'll see the chin muscles tighten, and you'll see the whole face move. And that's an indicator to me that this person doesn't use their muscles correctly. Now, that's not a diagnostic indicator that there's absolutely a tongue tie, but it tells me that there's muscle dysfunction. So now
Yes.
all of a sudden I'm cued to looking for things a little bit differently.
Yes. It's very eye-opening. And when people um realize that their face shouldn't move when they swallow, they're like, you've got to be kidding me. Because they can't do it,
Well, I've been aware of this for a while, and I've gone through my own myofunctional journey. I've had my tongue tie released. But, with doing more and more podcasts and more videos, I watch myself through editing, and I'll catch myself. I'm like, what am I doing right there? It's amazing how ingrained, even though I've now taught myself how to function correctly, how quickly I go back to muscle memory, and I'll watch myself do something that I'm like, whoa, that is not correct. I'm still defaulting to muscle memory that has been there for decades.
Yes, it's ingrained. I literally just took a drink of coffee and thought, oh my gosh, I better be careful.
I should have watched.
I know I got nervous. I was like, and I just made my face real silent. But if you do want to check out what we're doing, just in her facial silence, you can check our YouTube version of the podcast out. But I know Tracy was gonna ask
So I
me.
So
just did it on the video of showing how I was doing it with my mouth muscles.
Yeah, do that so people can see.
You see all that movement there
Yeah,
versus,
I can do it
so
too.
so Maggie, what are the, I mean, for our listeners, because there's very limited to no evidence and there's a lot of conjecture. What are the consequences for an adult? I mean, we know consequences for children, or there's conjecture to say that the consequences of tongue tie for children, but in an adult, fully developed,
yeah.
what are the consequences for an adult if we do not address the tongue tie?
Sure. Well, there's little things that we see clinically. It's really interesting. I've changed my perspective after doing, I don't know, thousands of surgeries and watching it. Actually, I wish Liz was here for this conversation because she was recently able to do a really neat study on a fresh cadaver. It hadn't been preserved for a really long time, and she performed a frenuloplasty on the cadaver, and it was really interesting, even not a live human, watching how the structure changed and watching how the chain effect went down, watching how the muscles changed.
Hmm.
But
Wow.
so one of the easiest ones, if you have restriction in how your tongues move or you're using your tongue differently, we're going to see an increased incidence of dental caries because it's easier to pocket the food. You're not creating a bolus of food and swallowing it. The food kind of gets mushed up and goes all around the mouth, and then you don't have the ability to self-cleanse by moving the tongue around. If the tongue doesn't move properly and is low tone, we always use the analogy of a bodybuilder. Somebody that's a bodybuilder is tight and compact, and you can see all the anatomy. If your tongue is not a bodybuilder and it's low tone, it takes up space, and that can impact occlusion. It can impact how the teeth come together because the tongue can sit over the chewing surfaces of the back teeth, and cause pressure on the teeth and actually act like an orthodontic device. It can thrust to try to create seal when it's swallowing, and that can create flaring of the front teeth. And then when it's low tone and sitting back and not up and tight on the roof of the mouth, it can encroach on the airway space and cause restriction in breathing, if not obstruction. So even in adults, it can create a lot of things that they need to work around or adapt around. Having been through it myself, so we used to think that fascia was really disorganized. And when I say fascia, I'm talking about kind of that white gauzy material that holds muscle to bone. I think of the white connective tissue in an orange. When you're peeling an orange, you're peeling away that fascia. Or on a chicken breast, when you're cooking, you peel the chicken breast, you peel that fascia off the chicken breast. So we have that in our body as well. We used to think that it was really disorganized, and now we know that it's actually very organized. There's different lines of fascia, and the anterior line of fascia starts at the tip of our tongue, and it goes down our neck, down our rib cage. It connects to our diaphragm. It goes to our hips. It crosses, and then it goes down to our toes. So that's one piece of fascia. So if our tongue has a short lingual frenum or constricted fascia, it's going to start to pull up on that entire strain. So a lot of adults will have chronic postural issues, chronic tightness in their head and neck that is from compensations from other things, but is absolutely exacerbated by not having full mobility because that tongue muscle cannot move freely.
And you do anecdotally, I mean, we all can say, not all of us, but many of us in this field can say anecdotally, we do hear, Tracy and I have talked about this before, patients will sometimes they almost get a little addicted to it, like, oh, I think you need to release me a little bit more because they feel this release. There
Yeah, I feel
is
like
a reported
100%.
release of sorts. We don't
Yeah.
have evidence of that. That's that I'm aware of. I mean, do you guys have anything where, there's been anything on adults with, I mean, it makes sense logically, everything's connected, the tensile strength, the tensile connection. Um, I know a lot of osteopaths that will talk about this topic as well. But as far as like evidence, is there anything in literature that is supporting
as far as like tensile strength and watching that release of tension,
Yes,
not
because
that I'm
it is
aware of.
I
reported.
mean,
It
I
is
think more
reported.
of like evidence in anything. I mean, like
Right,
a
right,
statement to
right.
say like tongue tie patients that with tongue tie have a high caries risk. I mean, like there's no evidence on that, and so we can't say that patients with tongue tie all have a high open bite tendency. Like I don't know if there's evidence in that, but I guess like for me, it's like because I think we all need to be aware of tongue ties, but it's important for us to educate the patient on like what are our yeah, as you guys know me, I'm always like, what are our goals?
Correct.
Like, and so I think what you guys have is it's amazing. So like how do you um educate and evaluate function? Because that's actually, I mean, that's something that's new. And I think that's amazing that I look at this program and it's like it's all about function. So how are you guys evaluating function for the average dentist that doesn't even know how to evaluate function?
True.
Yeah, I mean, if you're really interested in it, there's so many different courses that you can learn myofunctional therapy and really get into that. But I think that starting to be aware of small abnormalities in how we're using our muscles and then knowing when and how to refer and collaborate, right?
Hmm.
So what I've always said and will continue to say until I am gone is that, and this is part of the reasoning for taking away tongue tie center out of the name of my brand was, like you said, Tracy or Stacy, that people get addicted. They want a solution. They want that tension to be gone. But I think what it does is creates this unreasonable expectation that it's a magic bullet.
Right.
And so when we step back and say, let's optimize function, let's work with physical therapists for postural changes, let's work with, or postural idealization, let's work with a myofunctional therapist to get rid of the decompensations. If you can't reach the objectives of those therapeutic programs, if you can't optimize your function because there is still limitations in your movement because of a tight frenum, then it's appropriate to consider a surgical release, and only then. And I talk about how doing a tongue tie release is an adjunct to the therapy. So if the therapy cannot be completed because of the restriction in the tissue, then it's appropriate to do the surgery as an adjunct to the therapy, but in isolation from optimizing the function and in isolation from changing the way things are done, it doesn't do anything. In fact, it can make things a lot worse.
I was going there next. Great segue. Especially, you look in some of the forums with adult dental sleep medicine, you know, people will say, my patient just came in, they might want a mandibular advancement device, and they're saying they're hearing about tongue tie. And I did look, and they do have a tongue tie. They're not evaluating function. Of course, most dentists do not. They're just looking at an anatomical, it's tethered to the tip of the tongue, the heart shape at the tip of the tongue. And they're like, do I release it? So there's a few issues going on here. One,
Yeah.
you got dentists in adult airway going, do I release it? And there's all the debate of if you release a tongue on an adult with an airway issue, it's actually
Correct.
going to make it worse. And
Correct.
then some
Oh, but
people
there's
say
no evidence on that
there's
either.
no evidence on that either.
There's no
And then
evidence on
they'll
that
say
either.
it's no, it's going to make it better. And then you'll have somebody interject and say, look, it's how you do it. Make sure you have myofunctional therapy before. You've got a muscle that's been functioning for 40, 50, 60 years a certain way, and then you're going to lob off its connection and it doesn't know where to go, where to be, and it's flaccid.
We'll
And you
go back to the tongue, go back to the bodybuilder analogy, right? Like if it's being held down and held in a position and it's low tone, sometimes I think I would imagine that that's going to hold it in a better position than if you just release it and let it go, right?
yeah, it doesn't know what to
It
do,
doesn't
that
have any
muscle.
strength. It doesn't have any sort of tone.
And we have a lot of dentists out there. Look, I did releases 20 something years ago when I got out of school. I had a laser. I'm like, this is fun. It was
Yeah, there's
easy,
limited education on
very
that.
limited education. And I just released it. And then I found out, they come back weeks later. I'm like, oh, it's reattached. Now you got scar tissue. So we weren't taught, preparation for surgery. Just
Totally.
like it's a
And even,
physical therapy. It's physical therapy before a surgery and physical therapy after surgery. That's how it needs to be looked at.
yeah, I totally agree. And then even from the surgical, when I first started learning about it, I was so excited. I was like, oh, this makes so much sense. It's connected to everything. Like you said, Stacy, at the beginning of your career, but now understanding how it plays into a much broader picture is
Yes.
so important. And so when people come in and they say, I think I have a tongue tie, one of my first questions is, what does that mean to you? How is that bothering you? How is it impacting you? Why is it something that you would want to have released at this point? Okay, then, for us, we do a full exam. We don't just do limited exams for tongue ties. We do a full comprehensive exam. It involves a head and neck exam. It involves CT scan. It's looking at the whole picture, and it's really sitting down and then educating the patient and saying, okay, I can see that you have restriction in your tongue. Yes. And I see all these other issues. What you're telling me is your chief complaint is globally impacted by all of these things. To just look at your tongue tie on its own isn't responsible. And I think that sometimes can cause harm. And so I think that that's a really important thing to do when you're screening patients. And it's scary for patients or scary for providers to be a little bit different, especially when there's more and more people jumping on a bandwagon and offering the services. But at the end of the day, I want my treatment to be successful. I want my patients well taken care of. And if that's turning down surgery, that's okay with me. And we know that the body heals with constriction. So we know that there's going to be scarring. We know that there's going to be something that comes back. How prepared are they to handle the pre and post-operative care that's necessary to get good results?
I think that what you just said, I love what you just said. And that can be applied to a lot of things in airway.
It can be kind of applied to anything in dentistry. I want veneers.
I show up, I want an advancement device. I show up, I want MARPE. I want my intermolar width to be 45 millimeters. I mean, what's a beautiful thing right
We're all
now?
chasing numbers.
Yeah,
It's sad.
but patients are finally getting access to information. I think Stanley Liu said this really well the other day. Well, the other day, I mean like 8 months ago. That's how I talk. And he said, people are getting a lot of information, but not necessarily data. And it's like we got to take the information and start, making sense of it and putting pieces together. And some of that just takes time. We got information being fed to us like through a fire hose. And
Yeah.
how do we make that information data to make decisions? But really, it
Well,
goes back to what you're saying, Maggie, conversations. Why are you here for this specific thing? Tell me what that means to you. And listening to the patient, because what they think that tethered tissue could be causing could be other layers that have nothing to do with it, or it could have something to do with it. Um, what
so
do you go
I,
ahead, Trace? Were you going to say?
yeah. So I think what you're doing, Maggie, is amazing.
Mm-hmm.
I mean, I think that there's definitely a lot of misinformation about this, and I think it's really important that I think it's great how you explained how you did your comprehensive exam. I think you and Liz are doing an amazing job trying to educate more dentists, and that kind of goes into your program now because we need more of that. We really do need more education. Um, talk to us a little bit about what your mission is now with your current program. I think it's great that you're trying to educate and have more centers. And I think that we can all expect that the doctors that you are educating are well adversed in understanding what's going on. Um, from a patient standpoint, obviously there's so much information on podcasts and online, like what can what if I was a patient, what can I expect from coming to one of your locations? And then also as a dentist, if I'm new in my journey, obviously there's so many platforms, what can I expect to learn by joining your program?
I'll try to take it piece by piece. So as a patient, if you're seeking us out, and this is part of what was one of our early motivators was it was jaw dropping to me how far patients will travel to seek this kind of care out, and from a really humble perspective, like I am a small independent single dentist on the east side of Milwaukee, butting up against Lake Michigan, and people are traveling hours and hours to have a consultation with me. And I look around at the grocery store or at the airport, and I'm like, we are in an epidemic of mouth breathing and poor health. Why on earth do people have to travel so far to get this kind of information? And so often, when you connect the dots and you step back and you look at the whole picture, you understand the connection between the floor of the mouth, the floor of the nose, the way the jaw is supposed to grow, how the mouth and the jaw structure impacts airway, how airway impacts the rest of the health. When you step back and look at that, like you said before, Tracey, not considering the research part of things, but just like the connection of it is very simplistic to understand. And so often we as patients are seeking answers to a multitude of symptoms, a multitude of problems, and we're going to a lot of different providers and putting out individual fires when many times the root cause is related to breathing. And so if we can offer even a viewpoint that is stepping back and looking at the big picture of how things connect, that's the service that I think is invaluable. Now, that doesn't mean you have to go through with any sort of treatment modalities that might impact you at our office, but even just having that clarity of how things connect to make decisions about which treatment modalities you would be interested in, I think is something that is different and special about our practice and what we really want to teach general dentists to understand so that they don't jump in and start over treating or treating irresponsibly or offering things that are not realistic and promising expectations. So I think that that's something that we promise is like really stepping back and listening and looking at the big picture. And then from there, depending on goals, helping make referrals to conscientious collaborators for perhaps offering treatment in our office. So that was your question about the patients. As far as the dentists go, kind of a segue of that is just how do we start to recognize what's normal and what's abnormal, right? We've been taught, most of us have been out of school. I actually don't know what is being taught currently, but like when I was, like I said before, when I was at school, so many things that we didn't understand was a variation of normal. If we can start to understand what optimal is and what is suboptimal, we can start to recognize when things are problematic versus not. And so we want to help them understand the connection outside or stepping back further than just the teeth, not just looking at the teeth, but now from there, looking at the bone that the teeth are in, and then looking at how the bony structure lives in the face and how that impacts the airway and things from that perspective. I think there was a third question and I lost it.
No.
I don't know.
Stacey, did you have a question?
Well, I know we've been talking, well, I wanted to kind of back up a little bit in the very, very beginning. Um, we did talk about adults a bit, but for someone listening, that this is like the first time they've ever heard an episode on ASAP. For the listener right now going, well, what the heck? I have kids. Like, what are some of the issues with kids? Why is it so important? Why are people running to you, coming hours and hours away, to see you? What's the panic? Why are people concerned about their kids?
Well, and that's the other thing we like to do is we try to decrease the panic. We want to offer solutions and connections and information and also help them understand that not everything has to be done at once. But I think what happens, especially what my experience as a mom has been, is I want my kids to suffer less than I have. And when you start to recognize that some of your list of sufferings have been missed because of a missed root cause, a lot of parents want to have their children evaluated to see if there is a growth trajectory that will help minimize the risk of having to do so much of what I consider to be avoidable intervention. A lot of dentistry, I think, could be avoided if we had more optimal function from the beginning. So that's something that we talk about. And
What are some of the sufferings that
that I went through or that adult patients go through?
that kids could be going through that parents might need to say, hey, I've never even thought to look at their tongue.
Sure. I mean, I think it's more than the tongue. I think it's the breathing component, right? Like, are they breathing through their mouth? Are they having a hard time breathing through their nose? Are they struggling to get good quality, optimal sleep architecture and sleep patterns? Are they well rested? Do they have a hard time staying healthy? Do they have a tendency to be chronically ill. Now, these are not things that we're treating. We're just saying if these are things that you're noticing, the responsible thing to do, if you check enough boxes, the responsible thing to do is to evaluate structure. If the structure is suboptimal, we're not going to promise to take away all of the sufferings, but we can say, hey, we're going to decrease risk by putting the structure in the right place. If we can optimize function, we're going to decrease risk. Many times we will see a lot of these symptoms fall away. If they remain, now at least we know that structure and function aren't part of that piece of the suffering. Does that make sense? I think
A
I'm kind of
hundred,
talking.
yes.
Okay.
I love that description. It's funny. I was getting ready this morning, putting my makeup on, just thinking, like I often do, probably too much. But I thought some dentists are so hesitant to come into this arena. I come from an adult dental sleep medicine background. And, I'll go to, I'll go to our annual meetings or courses or whatever, and they'll come up, Stace, we're so glad you're doing the work because, we don't want to treat the kids. It's just too hard. It's too hard to treat the kids. And I'm like, it's it's not. If you really, it's a lot of fun. And I think they get honed in on doing everything, like you said. That's overwhelming. It's overwhelming for the patient. It's overwhelming for practitioners. You can look at this in layers. You can look at what something that you're really good at, or like collaborate with people in your community who is really amazing. Like, do you have a untethered clinic, health center in your town? Then refer to them for that. But
Is that the goal though, Stace? I mean,
well,
Megan, is that the
I was
goal?
just let me
Yeah.
finish what I was gonna say about what she said earlier about really it's not just the tongue. There's a lot of layers, but it can be just the mouth breathing alone. Like if a dentist is educated in understanding this whole, like, to get to a small child who is starting to breathe improperly at 2 years old. Oh my gosh. We all see the train wreck as an adult, but
Yeah.
like just to get to that and intervene there, like for dentists listening, for just please know your importance just in
Creating
identifying a
awareness.
child, the
Yeah, just creating
awareness.
awareness. Yeah.
Yeah, that you could actually, like you said, you were at the airport or you're looking at you're at the grocery store. It is a pandemic and you can make such an impact. So back to you. So if we can get more dentists educated, which is where ASAP comes from, like we're trying so hard to educate more dentists to be aware. You don't have to be the one doing expansion and finishing, but my gosh, the
Well,
impact you can make. But you're trying to educate as well.
well,
And
I have to give you guys a huge shout out and, a plug here because, when you become aware of this, you can't unsee it, right? Like once you see the connections and you learn everything, it does almost feel like a panic. Like we, as a provider and as a patient, like we need to do something. We need to tell people, no one told me this. I need to figure this out. And so I spent a ton of time not having any interest in doing anything outside of restorative dentistry. I was a good restorative dentist. I loved restorative dentistry. And so I was dragging colleagues, pediatric dentists, orthodontists, to courses across the country. I was bringing speakers into my community. And at a certain point, it was really hard to change their mindset and how they wanted to treat. And I was really frustrated and I had a chip on my shoulder about it. Um, Come on, you guys, we see this, we know this, but I also recognize that it's really hard to change what you're doing, especially when you have a thriving practice, and to change the modality of how you treat. And so I felt kind of helpless and I felt very compelled to start to learn how to do these treatment modalities. And had I not had access to ASAP, I don't know that I would have felt comfortable piecing together different treatment things that I wanted to bring into my practice, right? So I think that having the platform to create awareness is really important, but then also having access to where to go to learn how to start to intervene and implement the treatment if you're not going to be able to find collaborators in your community. So
so
thank you.
on that point, well, you're so welcome. And on this point of your wanting to get more access to care, and have more of these so people aren't having to travel. So the Untethered Way, it's a program to help dentists become more educated in this area,
Correct.
correct? Now, is the goal then I mean, your goal is you would like more clinics nationally, right? So that, or who,
We
internationally.
just think that access to this kind of care should be easier, right?
Yeah, yeah.
Luckily, you guys have clinics that are offering or practices that are offering this kind of treatment, and you guys have similar philosophies. But there's plenty of places around, I mean, everywhere, I think, that don't have access to this kind of care. So we would love to help, and it's overwhelming as a provider. How am I going to start to implement this? So what we would like to do is help implement the structure to, and we've learned through mistakes and through years of figuring it out on our own of how do you systemize this in a practice? How do you bring patients in? How do you screen them? How do you present treatment? How do you collaborate with people in your community? We really want to ultimately offer that kind of help to providers by offering that kind of structure, by either partnering with us, and opening another Untethered, or having us come and help you within your practice do that.
Okay. So options are, hey, you're like, this sounds fascinating. You're a practitioner listening. I would love an untethered clinic. Um, uh, so then they can get with you, get training, and then you know the system. It's basically like, hey, we know, don't reinvent the wheel. We know what to do, and we can
Correct.
get you set up in, you know, St. Louis or in, wherever, Idaho. And that so would they be then getting training through you as well? They would be basically like an untethered, verified kind of doctor. Like they would get the training through you and then you would help them set up the clinic as well.
Yes, and there would be more training that would need to be done outside of what we offer, right? So that we would recommend ASAP, we would
Okay.
recommend that they go
Well,
through,
thanks.
well, of course, we'd recommend that they go through, depending on the types of treatment that they already have awareness of and what they want to offer, um, they would need a lot of training. So that's not something that's going to happen really quickly or overnight. Now, if somebody's out there that's already practicing as a general dentist and they're saying, I've done all the ASAP courses, I do a lot of this treatment already, or I'm doing tongue tie releases, I'm doing airway screening, but I'm really struggling with how to implement it within my dental practice. Well, that's another way we can help, where we can help you. Here's how we structure our schedule. Here's the software we use. This is the billing codes we use. These are the systems that we've put in place. Now you can maintain your general dental practice and run that however you want to. Let us help you with this part of your practice. And that would be another way to do things.
Ah,
Are they considered, I'm trying to wrap my head around it. So like, are they going to be considered like affiliate practices of Untethered? Will they have the same philosophy as Untethered, same training? Because it sounds like it's like yes and no. It sounds like, oh, you can have it Untethered, but like we're just assisting you in some of the education but then at the same time, like to have multiple locations, I would think that we'd all have to have the same decision tree. You know what I'm saying? Like, so
Yeah.
how how does
That's what we're working on right now. Right now, we're really uniforming. We're really aligning our practices, and we're working with a big team of people to create that continuity before offering it. I've
got
been
it.
exposed to, as I'm sure you guys have too, a lot of, I think, not similar ideas, but quick to implement
mhm.
in any genre or niche. If you don't have it really planned out and organized before implementation, I think like Tracy, where I think your head is going is there's a lot of opportunity for confusion, failure, complication. And so that's where we are right now, is we're going through a lot of those processes behind the scene to iron that out, to make
Mhm.
sure that there is a lot of clarity behind what it would look like to be, you know,
Yeah.
your own general dental practice with a branch of untethered treatment versus a standalone option.
Yeah, I'd imagine there'd be some issues with like quality control in the form of like just making sure we're all on the same page and how we see things.
Oh
Well,
my
and that's
gosh,
something,
yeah.
where we're working on that right now. Of like, what is the educational platform? What is the educational pathway? What is the background that they have to have prior to us even being able to consider talking about implementing systems?
Well,
Ah,
as
that's great that you're
it
thinking about
is. That's
Of course,
excellent.
absolutely.
yeah.
That is excellent. I'm gonna do
And that, I mean, honestly, that's where I think a lot of collaboration between us could be really helpful.
well,
Yeah.
that's where I was getting ready to go too, is for people kind of wanting to get started on the journey of education, and then they can continue that education if they wanted to do an untethered clinic, health center with you guys. We do have a platform where we can get things going and get the education going for them. And like Tracy and I were saying earlier, this takes
It does.
all of us doing this together. We can't do this in our silos on our islands by ourselves. And we're just so proud of you, Meggie, and proud of
Thank you.
Liz for what you guys have accomplished and continue to accomplish and bring to the table to help change the world truly. Um,
Well, there's more patients out there than there are providers. And so I think that this attitude of collaboration and helping each other and trying to figure out where we can each excel will help get better care to more people.
well
So thank you
said.
guys for what you've created. It's an unbelievable platform. It's an unbelievable program.
Well,
And I would highly recommend anyone listening to take it or to join.
thank you, Meggie. We
Of course.
so appreciate you. I'm gonna plug kind of some options for patients, really, or patients for providers to be able to help more patients. We've got courses coming up, some live hands-on courses. We have our skeletal expander course. This is with Dr. Ilya Lipkin. He is a maverick when it comes to skeletal expansion. It's our part two. It's in New Jersey from September 13th to 14th. It's really about ortho finishing. So it's everything you need to know to make aligner therapy predictable in your practice. This is coordinating aligner treatment with MARPI, with TADS, learning how to place TADS. We even have an option for assistants to be able to get some education there too, part of your team. And then we have the early ortho intervention. This is with Dr. Courtney Levine. Both of our doctors are orthodontists and ASAP pathway members. This is a part two. This is October 9th through 11th. And this will have a price increase on August 1st. So I'm trying to get this out there so people can get in while it's a little bit less. You're going to gain confidence in early ortho intervention with this. We have hands-on skills for class 2 and class 3 elastics, and you're going to learn how to place brackets and again be part of a community and learn and talk and feel more comfortable to go back to your practice and do this for your patients, for your community. And then the final course we have is Advanced Frenectomy. This is with Dr. Tracy Tran. And this is September 27th. And this is reviewing basics, protocols, techniques, wound care, collaboration, case managing. All these things are important. Again, a price increase on August 1st. So jump in there while you can if you want to get some education on that. And then we have our immersion course. This starts up again. We have we have our second immersion course going right now, so you can't attend that one. It's already in session. But we will have our third and final for the year starting September 29th. You have to register by that day or you can't jump in with us. But this is reviewing all the online educational modules within ASAP Pathway from the comfort of your home. We meet once a month. We talk about what you're learning, answer questions, and that's really kind of how ASAP formed, was just kind of getting cozy, getting to know each other and talking like our Sunday chats. And that's why we developed the immersion platform. It allows you to get to know other people, not feel alone, and have these conversations and learn. So I'll put all the links for that in the podcast. I'm going to put the links for how you can follow Dr. Maggie Graham and Liz Turner, and how you can reach out for their education as well. So I'll be sure to put all of that in there. And then I have my final 3 questions. So here we go. Number 1, it's summertime. Snow cone, Maggie, or ice cream?
Oh, ice cream.
Oh,
Ice cream,
me
for
too.
sure.
Me too. What about you, Trace?
Ice cream.
Yes. I mean, I won't turn down a good snow cone, but it's got to
I
have
know.
that cream in it. Have you ever done that snow cone with the cream?
No.
Oh, it's so good. That makes the snow cone better for me anyway. Um, all right, Maggie.
I'm nervous.
City life or country?
Small city.
Small city. So not big city, more like, hey, I want to live
Like
somewhere
Milwaukee.
like Milwaukee. I want a little shop on the corner, kind of. It's still
Yeah.
kind of a small town feel, but it's
And
city
then
like.
really close to nature and being able to get free.
That's the best of both worlds. What about
Yeah.
you, Trace?
City.
Are you big? You're big city though, aren't you?
I like a little bit of both. I mean, like, the older I get, I'm more introverted, so every once in a while I go out in the country is fine, but yeah, but I do like the city. I like to be able to walk
How about
around.
you, Stacy?
Oh my gosh, this is so funny. I mean, I'm more suburb, visit the city, but I love country life. I love the woods. I love the woods. I could just sit outside. It energizes me. But Tracy said the older I get, I'm more introverted. I'm like, oh my gosh. I mean, I'll be 51 next month and I am becoming more of an introvert. And then I remembered something Tracy said to me in New York. She showed me this funny meme and she's like, I'm officially middle aged. Is it all of a sudden do cats just start magically showing up at your door?
I love that.
I'm like, oh my gosh, I'm waiting for all the cats to
It
be
must
at
be
my
something
front
with our
door.
hormones and our pheromones. They smell us.
They're like,
Oh,
she
when
smells
Stacy and
middle
I are
age.
together, we just go through memes. It's pretty funny. Like
I'm
that's
like,
a,
oh
that's
my
a,
gosh, I'm turning into the introverted. I mean, I have dogs, but man, what if I open the door and there's like
If I could
10
have
cats?
an animal sanctuary in the country, I would change my answer in a heartbeat. That would be my
Oh,
dream.
that is such a cool. Well, maybe that's your part two
That's
down the road.
yeah,
That
yeah.
in a
sounds
different chapter where I am right now. That will be my answer someday.
Oh, I love it. We'll have to have you back on and maybe that's what you transition to.
Yeah.
Okay, last question. And it's funny because I picked this and I didn't even realize I would have an answer for this, but I kind of do. What is the funniest thing that's ever happened to you on a vacation?
Oh man, that's a thinker. Oh, I mean, I was on a trip with my sister to Costa Rica, and on the bus ride on our way to the airport, I left my passport on that bus. And
Oh,
so it was such a silly, gosh, I can't believe this happened, but we ended up with very broken Spanish, taking a cab to the depot where all the buses, because it was like late at night, where all the buses were stored. And we walked through all these sleeping buses and found my passport.
oh my gosh, you've
I
got
just
to
can't
be
even believe that
kidding.
happened. Yeah.
Oh my gosh. Well, thank God you found it. I mean, you didn't even know, like, you're like, I don't know what bus I was on. So you're
Well,
searching.
no, I remembered the name of the company of the bus because I had the ticket in my pocket. And then like trying to explain that without knowing, having real fluency in the language was really hard. But that was at the time stressful, but pretty comical.
That is. I mean, looking back because you found the passport, it's funny, but when you're in it, it's not funny at all.
No.
Trace, what about you? Do you have a funny vacation story?
Mm, no, I think so. I
Anything
can't think of it right
weird?
off of it.
Well, I
All of my
remember
vacations
being on
are
a
fun.
trip with you and you thought you lost something really expensive
Oh
and,
yeah,
and you're like, "Oh my gosh, it's missing." I think I was more sick about it than you were, but
it
then you
was
wound
really
up
bad. And then I created this entire story of
a
how
whole story about what happened to it and then about 3 hours later she opens her bag and she's like, "Oh, here it is." I mean, we had a whole story about what happened, devastating,
yeah.
she lost
And
it,
I had a whole
or
story
it
about
was
how it was
stolen.
conned and when it was taken. I was like, I knew it. This is when it happened. And then
And then
was
she goes, "Oh, here it is. It's in the
It's
side."
right
I'm
here.
like,
I have it.
I had to let go of the story. It was like, well, for me, I was recently in Germany and yeah, lots of, oh gosh, thank God for the kind Germans that helped me and my kiddos. Oh, because we do not speak much German at all. And we're on a train, and in Germany, these trains run like clockwork, like, and it's a huge train. It's probably 20 cars long, extremely big train. I need to go to the bathroom. So I go to the bathroom and I find the car with the bathroom in it. And then I'm using the restroom and I have this aggressive man just aggressively banging on the bathroom door in this little tiny bathroom stall in the train. And I'm like, hold on, hold on. So I open the door. And I mean, the train is stopping at this point, and I open the door, and he's yelling at me in German And I said, I speak English. And he said, are you okay? And I said, I'm fine. I'm trying to go to the bathroom. I had such an attitude. And he said, I stopped the train. So apparently I was hitting all these buttons in the bathroom trying to figure out how to flush it.
Oh my gosh.
And it was an SOS button. And it
Oh
stopped,
my
it
God.
stopped the entire train. So I get back to the seat and my kids, they're all adults, like young adults, 17 through 22 at this point. They're like, there was an emergency stop on the train, Mom. I don't know what's wrong. I don't know what's wrong.
And you're like, I don't know either.
And I sat down and I got real quiet. I said, I stopped the train. I pressed the wrong button in the bathroom. And they were like, oh my gosh, like they need another reason to make fun of me. So, but yeah.
Oh, it's so funny. I'm glad that you were okay and it wasn't a bathroom emergency.
Yes, I'm glad I didn't need to be resuscitated, but apparently there's an SOS in the middle of this button and I didn't see it. So I was like, all these buttons do all these things. But yeah, that's my story.
And it's so funny that you had a chip on your shoulder. You were mad at him for like bothering you.
I was so
You're just trying to
upset.
make-
I'm like, I'm in the restroom. This is the rudest thing. Like why are these people banging on my door? I mean, I literally stopped the train. So
Oh my God.
they were, yeah, I got some looks when I walked out too. So wow, that was fun. Well, thank you for being on. And
Thank you for having me.
tell Liz we said hi. Oh,
I will. She
absolutely.
was so bummed to not be here.
Well, she's probably got her own travel story. That's why she wasn't even on. Is
It sounds like she will have quite
she's
a
probably
travel
going to
story
have
for
a
us.
travel story
I'll
herself.
see you guys in like August, right? I'll see you guys in San Antonio.
I'll be there. Couple weeks.
Yay.
Couple weeks.
Awesome.
A week at a time. Like next week I'll be at Coyce, then I gotta go to them. Like, oh,
You
So
guys are
much
always
travel.
traveling.
right.
All right, guys. Well, thanks so much for being on. Thanks everyone
Thanks
for
for
joining
having me.
us.
Bye.
And we'll see you next time. Bye, everybody.
Bye.
Bye.
This podcast would not be possible without the inspiration of my dad, Dan Becker, and creative direction and editing from the talented Jason Becker, Benjamin, and Judah Walker. To stay connected and keep the conversation going, be sure to subscribe to our podcast and visit our website at asappathway.com. And remember, the information in this podcast is for educational purposes only. It's not intended to be used as medical advice or replace your healthcare provider's diagnosis or recommendations.